I'm Maureen Chapman, and I was the first non-infant on the ECMO machine at Mass General.
We had our first child in 1986, December of 1986, and I was expecting the second child in December of 1988, which is Maureen. Had ear infections, history with ear infections, and she was put on some back-room maintenance medication. She started to get cranky, and
her eyes were glassy.
And her lips peeled, and she woke up with some red spots. And
they held every door, held every elevator, and she was wrapped up like a complete burn victim. Yeah. You could only see her lips and her eyes, and brought her over to Mass General Hospital and right up into intensive care, the NICU.
Maureen was a approximately 13-month-old little girl who had developed severe respiratory problems related to an allergic reaction to an antibiotic. She'd also developed severe skin issues as part of the reaction. The respiratory distress that she had was progressive and refractory to the normal treatment mechanisms.
The ventilator was at the maximum. Maureen was continuing to show low oxygen concentrations in her blood. Her carbon dioxide was going up.
I had gone to funeral homes and made plans for her, and I expected her not to make it. It was tough for me. She wasn't getting better.
We all felt that the only way to try to salvage her was to use extracorporeal life support, or ECMO.
As we talked to the family, they understood that this was really new therapy.
The ECMO machine was only used for infants. It was never used on a toddler. It was mainly for premature babies to be able to let their lungs develop. But they had no other options left, and they were trying this one.
It was Dr. Ryan who had first brought the ECMO program here to MGH in the treatment of newborn respiratory failure.
I felt that we had this technology that can be applied, and it might work.
This is her only chance.
Yeah, it was
we understood what they were going to do. They explained to her how they're going to cut her artery in her neck and pump it through the machine, oxidate the blood, and go back up into her neck and feed her brain.
What we didn't know was how long we should go. At the time, treatment was for 14 days at the most, and then you would discontinue support because it was felt that the respiratory failure was irreversible.
34 days she was on it.
On the ECMO machine alone, 34 days.
Yeah.
She was actually having a very stable ECMO run, and so going on another 4 days, another 3 days, another 5 days was practical, and that's why it seemed to us that we had to keep going.
I would go in every morning before work, and she never moved. I never saw her eyes open. And I was there one day, and I took her, I think it was her right index finger, and stuck it in my mouth. And just sucked on the finger and just whispered in her ear, "Daddy's here." Every day I went to the hospital after that and said, "Hi, Daddy's here." She moved that one finger, and I would stick it back in my mouth and let her know I was there.
She was not suffering any complications, and we did not have a specific reason to stop the ECMO treatment, and she started to get a little bit better.
They just knew that they could do something. I mean, as good as Ryan and Judy are, they just would not let go.
Then it got to the point where, because she was on the blood thinner, the heparin blood thinning medication, that she had a hemorrhage.
We were concerned that if we continued the ECMO, the hemorrhage would become catastrophic.
Dr. Ryan and I had talked to the family and explained that this means that we have to stop the ECMO therapy, and we were uncertain if Maureen would be able to survive, but that we weren't giving up.
I had my little talk with her that, if you've seen the light and you've fought enough, you don't go, but certainly love to have you stay.
I remember distinctly Miss Campbell asking for a rocking chair to be brought by because she wanted to hold Maureen if things deteriorated. Over the night, our PICU staff was just incredible and continued to support, and Dr. Ryan and I had stopped by several times over the evening. And the next day, we actually saw progress.
We woke up that next morning and my wife says, "Where's my chair?" And they all looked at us and said, "You don't need it."
Dr. Judy guaranteed me I wasn't going to need that chair.
The ECMO support literally pulled her back from the brink of death and gave her lungs time to then recover.
Because of their determination to save this little girl, which they were always optimistic, and
It just kept going.
it was successful. We have our little girl with us.
Maureen's success encouraged others around the country and around the world to treat these patients longer in order to get a good outcome.
The adult cardiac team was really interested in using ECMO as support, so we began changing our equipment and started a program for rescue of cardiac patients. They continued it for the adult respiratory patients, and then that carried over from this early terrible viral infections we saw in 2004, 2009 into the COVID crisis. Our hospital has been able to provide ECMO support for adults and even children who showed either cardiac or pulmonary complications related to the COVID virus infection.
There's got to be a pyramid of people, inverted pyramid people, that are on this earth now because Dr. Ryan and Dr. Duty thought it was important to keep going.
One can almost feel the progression, like, well, children are okay. What about a young adult? What about an older adult? What about heart failure?
Now, I think ECMO is much more common. Mass General has a whole ECMO unit, one of the biggest ones in the country. And in the middle of a worldwide pandemic, a machine like this has been life-saving for so many people.
And it really started with a little girl.
I'm Maureen, and I'm a first patient at Mass General Hospital.